Hello and welcome to HPA-Global Insights, where we'll be interviewing experts from the dietary supplement, nutritional ingredient, and overall natural health food industry. Please like, subscribe, turn on that little notification bell, and comment below. Now on with the show. Hi, welcome to the show. I'm happy to introduce our good friend, Dr. Bill Harris is here with us. And we're going to talk all about Omega3 and his institute. Bill, how you doing? Nice to see you.
Great. Good to see you again, Jeff. It's been a long time. Fond memories of our time together in Shanghai.
Yeah, it's been minimum 2 years plus. Yeah,
oh, yeah.
Probably 3 years ago. So let's dive into this. So you're involved in a new institute that you are the founder and president of. Fatty Acid Research Institute. So can you just give us a little introduction of what you're doing over there?
Well, I wish I had a more clever name, but that's the thing that popped up, and that describes exactly what we're doing. Our interest is in publishing more and more papers, doing more and more studies to draw connections between really blood levels of omega-3, typically omega-3, but we'll study any fatty acid, but primarily omega-3, levels of omega-3 and certain human disease outcomes. So we've, classically studied omega-3 and heart disease, but we're reaching out into other areas of illness, and we have access through our biostatistician, who's really the executive director of our foundation, Dr. Nathan Tintle, who is very good at getting access to very big databases of studies or observational groups, like the UK Biobank, which is a big one. And we can play around in that huge sandbox and find all kinds of relationships between omega-3 and health. That's what we're really trying to do.
Yeah, I saw the list, so people can, feel free to go on there. We'll have at the end of this your name card with the URL, website address, and all that. But I saw in there you got quite a extensive list of accomplished people there working with you in a variety of areas around the world. It's quite amazing.
Yeah, we were fortunate to be able to attract some attention and get some guys to join up. And so we're trying to have fun with this. Some of the guys that are signed up are well established and actually into their retirement. And so have some time, want to stay physically or intellectually active, and they're excited to be able to keep publishing, and they don't need to worry about going to the office.
Well, typically people think of, omega-3s. I think, consumer level people probably understand at this point in most countries, omega-3s associate that with fish oil, and that's pretty much it. If you go deeper and people have a better understanding, they might understand, EPA, DHA. But overall, I think most people will think of omega-3 and just think of heart, and just think of, cholesterol, heart, health, cardiovascular. But there's so many other things. We were talking earlier about this that are involved in that, and that's where a lot of your research is heading. So some of the studies that you've looked into and have done revolve around longevity. We were talking about that earlier. Can you just tell us a little bit about that one and how that came to be?
Yeah, it was really quite a good study, if I could say so myself. But I was part of, kind of led a team, a coalition of 17 cohort studies. So what's a cohort study? A cohort study is, if people know the Framingham study, that's the most common one. But it's basically a study where the researchers recruit a bunch of people in a town or across the country, or whatever, when they're healthy, when they're typically fairly young and healthy, and they do a million blood tests on them, and they do dietary questionnaires, and they do get all kinds of information. Then they just sit back and watch what happens to people over 5, 10, 15, 20 years, and they keep following up. So that's a prospective cohort study. So you're just following a group of people. And this study we did, we had, in these 17 cohorts, everybody had measured omega-3 levels in the blood at the beginning of the study. and not knowing necessarily what they're going to do about it, but they've got it and they've got it measured. And so what we did was we asked the question, was there a relationship between the omega-3 level in the blood and essentially your risk for death over about a 15-year period? Of course, when you ask about risk for death, ultimately the risk for death is 100%. I mean, right? So, but within a window of time, a given number, like between age 65 and 80, for example, a lot of people die. Some people do, some people don't. So in that window of time, was the omega-3 level a predictor of how long you'd live? And it was. People who had the highest omega-3 level were about, say, 15% less likely to die in that window of time than people who had a low omega-3. And we had took a lot of other factors into account for this study. So it was a big study published in one of the Nature journals. So that's a high impact journal. So we're real proud of that. But at the end of the day, what basically we're saying, look, if you look at studies all around the world, high omega-3 is protective, and not just total mortality, which we looked at that, but we also looked at death from cardiovascular disease and death from cancer and death from everything else, all pooled in one big pot. Okay, so we have three kind of what we call cause specific. And the omega-3 levels, it's the same thing. The higher the omega-3, the less likely we're to die of cancer, less likely to die of cardiovascular, less likely to die of everything else. So it's not just a cardiovascular connection. It's much wider than that.
Yeah, so in my personal life, I've been in this industry a very long time, and a good part of that in the beginning was in retail management and actually selling supplements. And one of the things, and this goes back, 30 years, and I've been taking omega-3s for that long. One of the things I always told people, because they come in and they would get lost, they didn't know what to take. There's so many articles to read. There's so many different things they could be taking. I said, let's start here, multivitamin, omega-3 supplement. And then we'll build from there. I mean, we'll look at, like, if your family history has got really bad diabetes or cardiovascular or something, then maybe you want to start looking at your nutrition and your lifestyle and what supplements can support those things. But I'm happy to hear that, because it's just 30 years ago, I was telling people to do that, and I'm not a scientist. It was just, one of those things, and omega-3 is just, affects every part of the body, and you're, exactly this research is definitely kind of pointing that out.
Yeah.
To be a bit more contemporary, and I don't want, to kill people with this word, but COVID, it's on everyone's mind. I think people are sick of hearing it. Everyone's getting vaccinated. I think we're probably 70% at this point in the US, maybe close to it or something. There was a small study you guys did about COVID. And omega-3.
Yeah. Toward the end of 2020, there were several papers being published saying, kind of, theoretical or hypothesis papers saying omega-3 ought to help with COVID because of this, because of this, because of this, but there was no data saying did it or didn't. It just made theoretical sense that it would be helpful. So we had the opportunity to work with a hospital, Cedars-Sinai Hospital in Los Angeles, where they had collected blood samples from 100 people who had been admitted to the hospital with COVID. And so we had the blood. We were able to measure the Omega-3 index, which is Omega-3 index is the amount of EPA and DHA in your red blood cell membranes, in a cellular membrane. So that's the test we came up with like almost 20 years ago now. And we've been using that in research and just in clinical care, as well as consumers can order that test too.
Sure.
But in any event, we measured the Omega-3 index on a dried blood spot collected from these patients who were admitted with COVID. And then we just basically divided them into 4 groups, highest to lowest omega-3. Those are called quartiles, just 4 groups, quartiles. And we asked, okay, the people in the highest quartile, the highest level of omega-3 compared to the other 3, was there any difference in their risk for dying in the hospital? And it turned out that their risk for dying was about 75% lower than people who had the lower omega-3 levels. It was not quite statistically significant, but it was pretty darn close. And for 100 people, and for the first paper on omega-3 and COVID, it was okay. So we were happy to get that published in January.
Wow, that's I guess from our industry, a lot of the antioxidants like vitamin D got a lot of attention, vitamin C, right. Zinc, in different countries were experimenting with that and finding some benefit. And omega-3 being one of those, really a macronutrient that just kind of, is involved in so many different bodily functions. Like you said, theoretically, it would make sense that it would be right. Beneficial. So that's very interesting to hear about that. You mentioned the Omega-3 Index. That I guess this is a good way to segue. I kind of wanted to share my own personal story with my recent, lipid profile. I'm at an age where I just want to keep track of it. My family's got very bad history with heart disease and death. My father passed away very young from cardiovascular disease and complicated with diabetes. His father passed away at a very young age. I never met my grandfather. So it's something.
How old was your dad when he died?
63.
Yeah, that's premature.
Yeah, so that was quite a while ago, but yeah, he just suffered with cardiovascular disease. His first heart attack, he was 42 years old and had a triple bypass. I remember very clearly waking up in the middle of the night. I was about 9 years old or so, with firemen in my bedroom, and I'm like, what's going on? Is our house on fire? And the medics were there to take my dad away. And that was the beginning of his, 20 plus year struggle with cardiovascular issues and all that. But anyways, so I'm kind of on top of this, and in terms of my own personal health. So one of the things we were talking earlier, one of the things omega-3 does affect or has some, in terms of cholesterol lipid profile you're mentioning is triglycerides was the big one. So my lipid, and again, this is probably genetic, and it's how my liver deals with cholesterol, both in my diet as well as pumping it out itself. My cholesterol is over 200. It's 221. So I'll put this on the screen later. My triglycerides, when measured, should be below 150. I'm at 72.
That's good.
HDL should be above 39. I'm at 53. And my overall risk is they do the risk ratio is 2.85, should be below 3.55. So I'm looking pretty good. I guess my overall cholesterol could be lower, but at the triglyceride level and HDL level, I'm doing pretty good.
Yeah, right. And you're not taking a statin.
No, but so my next question is, my cardiologist that I went to, a great guy, very accomplished in his career, but he had no suggestions about nutrition or omega-3 or anything. And I actually asked him about it and told him he knew, he knows what I do for a living and all that. So I kind of was not so happy that wasn't in his realm. It seems with him, it was more like, drugs or you get the knife, you choose.
What did he say when you asked about nutrition?
He said, well, in your situation, because you do exercise so much, because you're not overweight or obese, you exercise a lot, your cardiovascular stamina and everything is great. You're doing about I'm doing like an hour a day, doing treadmill or going on a 18-mile bike ride or something like this. Yeah. He said, I haven't seen anyone really effectively change their cholesterol levels for a person like you that's already not overweight, that already exercises, that already eats pretty cleanly. But there was no suggestion, or I don't think he really understands the aspect of supplements or other things that could be done dietary wise to have some kind of effect. He just wanted me to go on statins right away, and I said, no, I don't want to do that. So, in your experience, I mean, where is just to add on to this, are doctors not getting enough information about omega-3s and how they, it's like one of my friends, he's in the same boat, but his triglycerides are way high. and he does take an omega-3 supplement, but I asked him how much, and he was to me it just seemed like he wasn't taking enough, and he wasn't eating enough fatty fish or things that naturally have the omega-3. So
Right.
do doctors not have enough knowledge of this area?
Well, there's so much information out there about omega-3, and some trials have been negative or neutral, I guess you'd say. Didn't work. Some omega-3 trials, and they get a lot of press. And there's a lot of reasons why these studies don't work nowadays. They're short, they're high dose, they're taking old people who already got established disease and trying to turn that ship around. People are already on a bunch of medicines, trying to add some omega-3 and fix that, and it's pretty tough. And anyway, they get these studies that fail, get a lot of press. And so doctors typically think, oh, omega-3 doesn't work. But they haven't looked under the cover. They haven't really dug in deeply into it. And who can blame them? I mean, they're swamped with other stuff. And so we just keep fighting the fight, keep adding papers to the literature. Maybe it's just one of these days people will figure it out.
So with that in mind, you know, one of the companies you were involved in and started was Omega-Quant, which I actually took 2 tests now, and as you mentioned earlier, and it's a very important test. It should be part of like this, you know, this lipid profile I have here. It should be part of that.
Absolutely.
But it's not. There's no measurement at all on here about omega-3. So the omega-3 index.
Very few labs. Very few labs do it. Very few labs doctors order it or know about it. A few do. A lot of our functional medicine doctors are using omega-3 testing. But I do think your omega-3 level, your omega-3 index, which again is the red blood cell EPA and DHA level, and it's expressed as a percent. It's a percent of the fatty acids that are in the membrane that are EPA and DHA. So higher is better. We think 8% and above is sort of the target, the sweet spot. Unfortunately, 95% of Americans are below that. Not a surprise. So there's a lot of room for improvement. So that's really our target, and we like to titrate people if we can, get them to, you know, do a test, find out where they're at, suggest supplements that will get them up to. It takes 2 or 3 months, 4 months maybe, to change your omega-3 level, get it back up to the new level. When's the last time we tested you, Jeff?
Yeah, so I've been tested twice, and it's been a while. I think the last one was probably two and a half years ago, maybe.
Yeah. Time to re-up.
Yeah, so I was a 5 the first test, and then I went up to 6. I don't have it in front. I should have it in front of me. I think I went up to about 6 point something. So I did improve, and I did wait 3 months in between to give it time to build back up. But just knowing that the measurement is in the red blood cell, just not even being a physician or doctor or scientist, blood is everywhere in your body. So it's in your eyes, your brain, it's everywhere. So it just makes sense that these levels should be part of an overall profile when you're going to get your health check, that you've got adequate amount of omega-3. And I think we're in a position now in the world where there's lots of you're the consumer that's trying to educate themselves, kind of stuck in the middle, because on one side you're hearing a lot about, you know, don't eat too much fish, it's poisoned, it's got arsenic and mercury, and you can't eat too much of the fish, blah blah blah. And on the other side you've got, you know, these high profile media profiles anyways coming out saying, oh, the omega-3 supplements don't work. So but obviously omega-3 has a super valuable function in our body. If we're not getting it from fatty fish because we decided, from what we've heard, we shouldn't be eating too much of that, and now we're seeing, oh, omega-3 supplements don't work, we're, you know, as a consumer, kind of stuck. Well, how do I get this in my body?
Yeah, and unfortunately, omega-3 doesn't work. It's very simplified and very misleading. Sure. That's the problem. The soundbite is what keeps people away. In fact, this whole fear of fish is ridiculous. Yeah. Based on the real evidence. I don't want to get into that. mercury in pregnant women and development and all that. And
Yeah.
The women that are avoiding, or pregnant women that are avoiding fish, are doing more damage to their baby because they're not getting omega-3 as they avoid fish, than eating the fish that has a tiny little bit of mercury in it, which is not going to hurt. I mean,
Yeah.
all the evidence, if you look at the whole body of evidence, it doesn't make any sense to avoid fish when you're pregnant. But
yeah, and DHA, part of that omega-3, that's the real big one for like brain development and all that stuff. So that's crazy. So supplements definitely should be taking those, and definitely grabbing some fatty fish, not every day, but when you can.
Yeah, right. Exactly.
So yeah, I'm going to actually get my omega-3 done soon again, because it's been a while. I'm excited to see that, because I have started taking a little bit higher dose over the last year or so, in terms of omega-3. So I would suspect that my level should hopefully go up a little bit.
Yeah.
To wrap this up again, the COVID also put, if anyone's interested in getting their Omega-3 index done too, we'll put that at the end so people can see, where they can go and get that done. Because like you said, there's not many people doing it, and know how to.
It's an at-home collection. You just order it online. It's mailed to your house. You prick your finger, put a drop of blood on a card, and mail it in.
Yep. Very simple.
We do vitamin D as well in the same way.
Yeah, vitamin D's, like we talked about before, is a big one, especially with all the COVID stuff. Again, COVID keeping us all in home and away from conferences and expos and speaking engagements and all these things. Yeah. Just to wrap this up, where are you going to be? In terms of any good research coming up, or just recently published, or any events you're going to be going to or speaking at?
No, I just was on, we had what's called the ISFAL meeting, which is the Fatty Acid Research Society, International Fatty Acid Research Group. That was a month ago, and American Oil Chemist Society and the American Society of Nutrition all just had their meetings, and I was a part of all three of those here in the late spring, all virtual, of course.
Sure, yeah.
In person, it's not going to be till 22. I'm pretty sure, before I'm back in person at any meetings, which is okay with me.
Yeah. Well, you're international too. I know that's, like we said earlier, we last time we were together, we were in Shanghai. So international travel is really the key here, is when what countries are opening, which countries are not doing well. And so I think it's still going to be a while before that clears up.
It's going to be a while.
And then what about research? Anything that you're working on now, or just recently got out the door that we can talk about?
Well, sure. We just, it was Monday, I believe. Came out, our latest study, where we're looking at, we were again looking at one of these cohorts of people, the Framingham study, which is from Boston, that area. It's really the most famous observational study of a population in the world, because it was the first one. In any event, we were able to measure, again, omega-3 levels, and we, again, linked them to how long people live. And the one thing we were able to do in this study was to show that, yes, the people who lived the longest had the highest omega-3. That makes sense. But we were able to compare having a high omega-3 with something like not smoking, as other risk factors everybody's pretty comfortable with. And so it turned out that if you're a smoker, really at about age 65, this is what we're talking about.
Okay.
If you're a smoker at age 65, or if you have a low omega-3 level, you really have about the same risk for death over the next 10 years. Wow. So a low omega-3 relative to a high is a risk factor for early death, just like smoking versus non-smoking is a risk factor for premature death. So we're trying to get our handle. We've always believed that the omega-3 index is a risk factor, like cholesterol, like blood pressure, like diabetes, which is also a risk factor for heart disease. But we haven't been able to, get a comparison to where we say, well, it's like that one. You're familiar with cholesterol levels being a risk factor. Well, if you think that's a risk factor, you ought to look at this, that kind of thing. So here we have been able to compare it with smoking, and it's really in the same class as not smoking. Having a high omega-3 is like not smoking in a way. It's good for you. So that one's come out, and we're planning other studies where we look at risk for development. It's almost too early to do studies on COVID in these big populations, but we can look. We're going to do a study within Framingham looking at risk for pneumonia. And since pneumonia is something that's been recorded a lot, and people know about pneumonia, it's of course, obviously a lung infection, and so we think the high omega-3 is going to be protective against developing pneumonia too, which plays into the COVID idea.
Okay, wow. Well, it's again, these indexes, it's a tool. I mean, it's important to know. It could definitely be, I hope, more physicians graduating and getting out there, and cardiologists learn more, positive news and understand the Omega-3 index, and can, kind of incorporate that as one of their tools. Like what I just went through with my cardiologist, he put me through all the paces. I got my blood work done. I got a stress test on the treadmill, so they could look at my heart walls, and then they did an echocardiogram, and then also did the what do you call, the Holter monitor, where you actually, I wore a device for 5 days to track my, any irregular heartbeats. And so all those tools he kind of used to build a picture of this guy, Jeff, and, what risk does this guy have? And, thankfully right now I don't have any. My cholesterol is a little high, but not in a risk factor, but it'd be nice to have that omega-3 there too, to show that other level of what's going on in Jeff's blood.
Right. I'm sure the reason the doctor is concerned is because, as we talked earlier, you have a pretty severe family history.
Yes.
Men in your family having early heart attacks, and that's putting you at risk. That's why the cardiologist is so interested in tracking this stuff while you're younger.
Yeah, and I was all for it. I mean, I just, I want to know. I've got a young son and family, and I don't want to one day just, check out prematurely if I can avoid that. And these are tools for me. It's like, okay, where am I at? What can I do to better myself?
Perfect. Right.
All right. Well, I encourage anyone to just, read in, if you got time, read into the history, your history, but also the history of omega-3s. It's fascinating, coming, from the beginnings, and what was it, 1970s, early 70s, where people really started, studying the relationship between omega-3 and diet. And was it the Inuit people, or and just having that. I mean, just look into it. We don't have time to go into that, but look into it. It's fascinating stuff, and it makes a lot of sense. I hope I see you soon in person. Hopefully, maybe next year.
We've got to come down to Austin.
Yeah, awesome. Austin. Try to say that a few times fast. All right, again, thank you so much for your time and insights. Appreciate it so much. And
happy to do it, Jeff. Good to see you.
Yeah, good to see you. Have a great weekend, and we'll be in touch.
All right, take care.
All right, take care. Bye-bye. Thank you for tuning in to HPA Global Insights. Please like, subscribe, and share with your colleagues. Any questions or suggestions, email us at info@uschinahpa.org. This channel is operated by US China Health Products Association, which is a nonprofit organization. Please consider joining the association and supporting its global endeavors. Your support is very much appreciated. Until next time, take care.